Welcome back, everybody, to the deep dive. You know we like to get into the weeds here, and today we're diving into urology.
Ooh, fun.
Not from the doctor's perspective, though.
Right.
We're going behind the scenes, with medical coding.
Okay.
That critical link between, the procedures and actually getting paid for them.
Exactly.
And we've got some fascinating sources for this deep dive, including the Male Systems Facts to Remember.
Yes.
It's from the Absolute Medical Coding Institute's Medical Coding Guidelines Manual.
The MCG.
Yes, the MCG. We'll just call it that from now on.
Good.
It's linked in a description if you want to follow along at home.
Please do.
I was looking through this and I was already seeing things in there.
Oh, yeah.
That made me think wait, even that gets coded specifically.
You would be surprised.
Yeah,
Urology coding, it's very nuanced.
Okay.
You'd be amazed at what details actually matter for billing.
All right, well, let's jump right in.
Okay.
We're focusing on circumcision, vasectomy repair
Yeah.
of penile tissue, and prostatectomy.
Those are the big ones.
Yeah, procedures that most people have at least heard of.
Right.
But trust me,
Oh, yeah.
the coding side of things is way more interesting than you might think at first glance.
Definitely.
So let's start with circumcision.
Okay.
Most people, I think, associate it with newborns,
Yeah.
but it can be performed at any age, right?
You can.
And that impacts the codes.
Absolutely.
So even if it's the same procedure, patient age changes the code.
Yes, it does.
That's interesting.
Absolutely.
So CPT codes 54150 through 54163
that's the range.
cover circumcision. So within that range,
Yep.
certain codes are for newborns.
Right.
Others are for older patients.
Correct.
But even within those categories,
Yes.
there's more to consider.
I always.
Like what I'm seeing in the MCG. The facts to remember, or FTRs as we like to call them,
Yes.
mention different methods.
Right.
Like clamp device.
Exactly.
Is that what you mean?
Precisely.
So the method used impacts the code. And here's something else
Okay.
that I did not expect.
What's that?
Whether a nerve block is used is also coded.
Oh, yeah.
Like with a modifier,
Yes.
modifier 52,
52.
if no nerve block is administered.
Mm-hmm.
Wow.
Makes sense.
I never realized there were so many variations.
Yeah.
Why is that so important for the coding?
Yeah.
Is it about cost or is it about something else?
It's
Or a little bit of both?
Yeah.
I don't know.
It's about reflecting the complexity of the procedure.
Okay.
A circumcision with a nerve block
Yeah.
is considered more complex
Okay.
and therefore may have a higher reimbursement rate.
Oh, okay. So it is about money.
Well, yeah,
So those little details really can add up.
they do.
And speaking of details, I'm also seeing a special modifier 63 for babies under 4 kilograms.
Yes.
Tiny patients.
Tiny patients.
Big coding impact.
Big impact, exactly.
Okay, so that highlights how medical coders need to be aware
Right.
of even the smallest patients.
Yes.
And the specific guidelines that apply to them.
Yes. Very important.
Okay, moving on to vasectomies.
Okay.
I'm guessing most people
I would agree.
think that it's just one code.
Yes. Snip, snip.
Snip, snip, done.
Done.
But I bet it's way more complicated than that.
It is.
The standard code 55250
Right.
is specifically for bilateral sterilization.
That's correct.
But what if there's a complication?
Right.
Or it's only done on one side?
Exactly.
That's where things, I bet, get interesting.
It does.
So if it's not a complete vasectomy,
Mm-hmm.
the coding changes.
Yes.
So modifier 52 would be used again in those cases.
Right.
And this underscores a crucial point.
Yes.
Clear documentation
Yes.
from the doctor is essential
Absolutely.
for accurate coding.
Yes.
Imagine a coder looking at a chart that just says vasectomy performed.
Right.
They wouldn't know if it was bilateral, unilateral, complete, or incomplete.
Exactly.
That makes total sense.
Yeah.
Without that level of detail.
Right.
It'd be like trying to solve a puzzle with missing pieces.
Exactly. A perfect analogy.
Yeah. Now let's switch gears to something a bit less well-known, I guess you could say, repair of penile tissue.
Okay.
Not exactly dinner table conversation,
No.
but the coding is just as fascinating.
Absolutely.
So bring on the less discussed stuff.
Okay.
I'm seeing codes 543 to 5436 here in the MCG.
Yes.
What's the main thing
Yes.
that determines which code gets used?
The key distinction is between simple and complex repairs.
Okay.
And what makes a repair complex is the use of grafts or flaps.
Hold on.
Yeah.
Grafts and flaps.
Yeah.
I'm picturing like skin grafts.
Exactly.
Is that what we're talking about here?
Yeah.
These procedures involve taking tissue
Right.
from one part of the body
Yep.
and using it to repair the penile tissue. It adds a whole other layer of complexity.
It does.
both surgically and for coding.
Absolutely.
Wow. So even though it's all repair,
Right.
the specific technique
Yeah.
changes the code significantly.
Absolutely.
It highlights how coders can't just focus on the name of a procedure.
No.
They need to understand the details of what was actually done
Exactly.
to choose the right code.
Well, that's right.
Okay, last but definitely not least, let's talk about prostatectomies.
Okay.
This is a big one,
It is.
both medically
Yeah.
and I'm assuming for coding.
And for coding, yes.
Where do we even start with this one?
So prostatectomies are a prime example of how surgical advancements impact coding.
Okay.
We've got codes 55810 through 55866
Okay.
to cover everything from simple to radical prostatectomies. And each type has different approaches.
I'm seeing suprapubic, laparoscopic,
Yep.
and robotic assisted.
That's the new one.
That last one sounds especially high tech.
It is.
Is that becoming more common?
It is.
I had a feeling.
Yeah.
So you're right to notice that code 55866 is specifically for robotic-assisted prostatectomies.
Yeah.
But even beyond the approach, there's the question of whether a lymphadenectomy,
Yes.
the removal of lymph nodes,
Uh-huh.
was performed at the same time.
Exactly.
So it's not just about coding the prostatectomy itself.
Right.
It's about capturing the entire surgical picture.
Exactly.
And that level of detail directly impacts billing.
Yes.
And ensures that both the surgeon's work
Right.
and the patient's specific situation are accurately reflected.
Exactly.
That makes a lot of sense.
Yes.
All this talk about codes and modifiers
Yeah.
has my head spinning a little bit.
I can understand that.
Let's take a moment to process this information.
Yeah, let's regroup.
And come back to explore more of these fascinating urological procedures and their coding quirks.
Sounds good.
I'm excited.
Me too. Welcome back.
We're back.
All right.
I feel like I need a little bit more coffee,
Me too.
but I'm
That's
ready
sure good.
to dive back in.
Awesome.
Before we move on, I think it's worth emphasizing just how much specialized knowledge medical coders
Absolutely.
need to have.
Incredible.
It's like they're deciphering a secret language,
Is
translating doctor speak
yeah.
into a code everyone else in the healthcare system
Right.
understand.
Yeah.
It's amazing.
It is.
And they need to be detectives too,
Yes.
digging through medical records
Oh, yeah.
for those crucial details that determine the right code.
Exactly.
All right, so let's put on our detective hats and tackle some more of these urological procedures.
Right.
What's next on our list?
So next up is transurethral resection of the prostate, or TURP for short.
TURP, got it.
It's a very common procedure for an enlarged prostate.
Okay, so what kind of coding complexities come up with this one?
Well, first the coder needs to know the method.
Okay.
Was it a traditional TURP, or did they use laser vaporization?
Okay.
Then was it done for benign prostatic hypertrophy or BPH? And of course, the extent of tissue removal is also important.
Wow, it's amazing.
It is.
How many factors go into coding even a quote-unquote routine procedure like this?
Absolutely. And don't forget, we also need to consider any additional work done during the TURP.
Oh.
Was a biopsy taken?
Oh, wow.
Were there other adjunct procedures? It all impacts the coding.
Okay. I'm starting to see why medical coders need such sharp attention to detail.
Yes, they do.
It's incredible.
Yeah.
All right, speaking of detail-oriented work, let's move on to penile lesions.
Right.
These aren't exactly pleasant to think about.
No.
But they highlight how specific coding can get.
Absolutely.
All right, bring on the nitty-gritty details.
Okay, so for simply draining a penile lesion, we're looking at codes 54000 through 54065.
Okay.
But the type of lesion matters.
Okay.
Is it an abscess or something else?
Oh,
and how was it drained?
Interesting.
Simple incision chemicals, cryothermal methods.
Wait, so even the method of destroying the lesion affects the code?
It does.
That's wild.
It is.
And coders need to determine if it was just drainage or if it involved more extensive intervention.
Exactly.
Again, it all comes back to that clear documentation from the physician.
Absolutely.
Clear documentation is like the coder's best friend, isn't it?
It's their lifeline.
What about when we're talking about excising?
Right.
A penile lesion, not just draining it.
Good question. Then we shift to codes 54100 through 54111.
Okay.
Here, the size and location of the lesion become critical, along with whether the excision was simple or extensive.
I'm sensing a theme here.
Yes.
So much of this comes down to those precise details.
He really does.
It's incredible.
Yeah.
And that theme continues as we move down the list of urological procedures.
It does.
Let's take orchiectomy, the removal of a testicle, for example.
Yes.
I know that can be done for a variety of reasons. Does the reason for the orchiectomy impact the code?
Absolutely. Codes 54520 through 54535 cover orchiectomies. And the coder needs to determine if it was a simple or radical orchiectomy, whether it was unilateral or bilateral.
Okay.
And as always, if anything else was done during the procedure.
So even a procedure that sounds straightforward on the surface has all these layers of coding complexity.
It's like an onion.
It's amazing.
It is, and this really highlights the importance of collaboration between physicians and coders.
I was just thinking that. It seems like they really need to be on the same page.
They do.
To make sure everything is coded correctly.
Absolutely. Clear documentation from the physician allows the coder to accurately translate those medical procedures into the language of codes, which ultimately ensures accurate billing.
It's like they're partners in a way.
They are.
Making sure everything runs smoothly behind the scenes.
Exactly. They're both essential parts of the healthcare system.
That's a good point.
Now, we've talked about removing testicles.
Yeah.
But what about fixing them?
Oh.
That's where orchiopexy comes in.
Orchiopexy, that rings a bell.
Yes.
It's for undescended testicles, right?
You are right. CPT codes 54640 through 54692 cover orchiopexy.
Wow.
The coder needs to determine if it was done laparoscopically or as an open procedure, and how the testicle was fixed.
Wait, even the method of fixing it matters for the code?
It does, and they also need to see if any other structures were repaired or repositioned during the procedure.
Okay.
You see, these seemingly small details can have a significant impact on the final code selection.
It really makes you appreciate the meticulous work that medical coders do.
Absolutely.
They're like the unsung heroes of healthcare.
Couldn't have said it better myself.
Seriously.
No.
They're doing all this work behind the scenes that nobody really knows about.
Exactly.
But it's so important.
It is.
Now we've discussed orchiectomy and orchiopexy, which involve the testicles themselves.
Right.
What about procedures on the epididymis?
Oh, good point.
Remind me, what is that again?
So the epididymis is a coiled tube attached to the testicle that stores and transports sperm.
Right, there.
And the removal of the epididymis is called an epididymectomy.
Epididymectomy, got it.
So how does that fit into our coding puzzle?
Yeah, where does that one fall?
CPT codes 54840 through 54861 are used for this procedure.
Okay.
The main question here is whether the epididymis was removed on one or both sides.
Bilateral or unilateral? That seems to be a recurring theme in urological coding.
It is.
And I'm guessing any other structures removed or treated during the procedure would also affect the code.
You're absolutely right. It's all about capturing the complete picture of what happened during the surgery.
All right, so we've covered procedures involving testicles and the epididymis.
Right.
What about the scrotum itself?
Good point. Let's take a look at incision and drainage of the scrotum.
Okay.
Often done for scrotal abscesses or hydrocele.
Incision and drainage. So if a doctor simply makes an incision and drains fluid, that's one code? But what if it's more complicated than that?
You're thinking like a coder already.
I'm trying.
CPT codes 55000 through 55040 cover these procedures.
Okay.
Coders need to determine whether it was a simple incision and drainage or an excision of a hydrocele.
And I'm assuming the method of drainage or excision, like we discussed with penile lesions, would also be important.
Exactly. And if it's a recurrent hydrocele, coders need to check if any additional surgical measures like sclerotherapy were performed.
Wow. It's amazing how each layer we peel back reveals even more coding intricacies.
Yes.
It really is like a detective game.
It is. And like any good detective, medical coders need to be thorough and methodical, ensuring every detail is considered before arriving at the final code.
Well, we've covered quite a few procedures already.
We have.
What else is on our list?
Let's revisit vasectomy. We touched on it earlier.
Yeah.
But there's a bit more to unpack.
Oh, right. I remember you mentioning that the standard code 55252 is specifically for a bilateral vasectomy done for sterilization.
Yes.
But what if it's not a bilateral procedure or not for sterilization?
You remembered correctly. If it's unilateral or incomplete, we would bring in Modifier 52 again.
Oh, Modifier 52.
There it is.
It's back.
Our friend.
This highlights the importance of clear documentation.
Yes.
The coder needs to know why the vasectomy was performed and exactly what was done.
Yes.
To select the right code.
Exactly.
Modifier 52 is like the MVP of urological coding.
It really does. It seems to come up in so many different scenarios.
Yeah, it really does.
It's a great example of how a seemingly small detail, like whether a procedure was performed on one or both sides, can have a big impact on the coding.
Yeah, it can completely change the code.
Absolutely.
That's wild.
It is.
Okay, before my brain reaches code overload, let's take a moment to refresh.
Oh, sounds good.
We've explored a lot of territory already, and there's still more to discover.
A little bit more. Welcome back to the deep dive.
We're back.
Oh.
I feel like we've been on this journey for a while now.
We have a few more stops left.
But before we wrap up, what else should we explore in this fascinating world of urological coding?
Let's talk about prostate biopsies.
Okay.
They're a crucial diagnostic tool for prostate cancer.
Prostate biopsies. Those sound pretty serious.
They can be.
What makes the coding tricky for those?
Well, the first thing a coder needs to know is how the biopsy was performed.
Okay.
Was it a needle biopsy or a transurethral approach?
So even though it's all about getting a tissue sample, the method makes a coding difference.
It does.
Why is that?
Well, different approaches have different levels of complexity.
Okay.
And that's reflected in the codes. You'll find the codes for prostate biopsies ranging from 55700 to 55725.
Okay, so like a needle biopsy might be more straightforward.
Right.
Whereas going through the urethra might be more involved.
More involved, exactly.
And therefore more complex.
And therefore a different code.
Gotcha.
And on top of that, coders have to see if any other procedures were done during the same session.
Okay, right.
Like, was a cystoscopy performed at the same time?
Oh, wow. So many things to consider.
It is.
Yeah, plus if they use imaging guidance, like ultrasound, that needs a separate code.
Absolutely.
Wow, it really emphasizes how coding captures the full picture of what happened, not just like the main procedure.
Exactly, the whole story, the whole surgical story.
Amazing.
Now, before we move on, I want to circle back to vasectomies briefly. Okay. We talked about the standard code, but there's another aspect I think you'll find interesting.
Oh, more vasectomy mysteries to uncover.
A few!
Lay it on me.
What if a vasectomy is performed for a reason other than sterilization?
Okay.
Like to treat chronic pain or infection?
Oh, interesting.
Then we wouldn't use that standard 55250 code.
So it's not enough to know what was done.
Right.
The coder also needs to know why.
The why, yes, very important.
That's a good point.
Medical coding isn't just about memorizing a bunch of numbers.
Right.
It's about understanding the medical context.
Right.
And applying that knowledge to choose the most accurate code.
Okay, that makes a lot of sense.
Good.
Now, I know we've been focusing on specific procedures.
We have.
But is there a bigger takeaway here?
Yeah.
Something that kind of ties all of this together?
The overarching theme, as we've seen, is that medical coding in urology is incredibly detail-oriented and nuanced.
It is.
Coders need deep knowledge of both anatomy and procedures and the coding guidelines themselves.
Right. They need to know both sides of it.
They do. It's like they're bilingual.
They're like the bilingual translators of the medical world.
I like that analogy.
That's what it feels like.
They're the bridge between what happens in the exam room and how it gets communicated to the rest of the healthcare system.
And as we wrap up our deep dive, I have one final question for you. We talked about robotic-assisted prostatectomy earlier.
Yes.
What happens to coding as surgical techniques keep advancing?
Oh, that's a great question.
New codes, right?
Yeah, as surgery evolves, so too must medical coding.
It only makes sense.
We can expect to see new codes and modifiers emerge to accurately reflect these advancements.
Absolutely.
It'll be an ongoing challenge for coders to stay at the forefront of both medical and coding knowledge.
Well, there you have it.
That's it.
Our deep dive into urological procedures.
Yes.
And the fascinating world of medical coding.
Absolutely.
It's been an eye-opening look at the complexity and importance of this often overlooked aspect of healthcare.
I agree.
Huge thanks to the
MCG
for helping us navigate this intricate world.
Yes, thank you, MCG.
If you're interested in learning more, be sure to check out the link
to
the Absolute Medical Coding Institute's Medical Coding Guidelines Manual.
It's in the description.
In the description.
Hello.
It's a fantastic resource for anyone who wants to explore this intricate world further.
Absolutely.
Until next time, Keep diving deep.
Keep diving.
And discovering the hidden wonders of knowledge.
See you next time.